Welcome back to module number 9, where we'll be talking about providing quality care. So we've taken all this care to get all of our legal ducks in a row. We've found the perfect location. We've selected the electronic medical record. We have the team. Now it's time to get out there and provide that care, that quality care, because that's what sets us in direct primary care apart from our traditional healthcare model. They're treating patients like cattle. We're loving on them like family, the family that you like, not the family on daddy's side. So in providing, one of the core things to do to provide some good quality care is to have some established protocols and procedures, laying it out. What are your guidelines? So what is your protocol amongst you and your staff for labs? An example we use here is the labs are drawn at that very first visit. I have a panel, a very set panel of established labs that my team already knows. Draw those labs. We don't have to talk about it. If I want to add something special, we'll go back and add those special things. But as a standard, this is what we're going to do. The labs are drawn. I have the first visit with them. Everyone who checks out at the checkout station is automatically getting a discharge summary from me, and I will attach a copy of my discharge summary for you. And it says to my checkout girl, I want to see this person in 2 weeks. In 2 weeks, they're going to come back and sit in the office with me for a lab review. Now that's setting us apart, because most people get their labs drawn. They have no idea what the results are, or Quest or LabCorp will send them an alert. It says anything to the left or right in red. The patient goes to Google, and now they're diagnosing themselves with WebMD with thyroid cancer or parathyroid or something crazy, because no one's explaining it to them. We provide quality care. So our patients come back, they sit in the chair, I sit next to them, and I go over the labs line by line. This means drink more water. This means stop drinking alcohol. This means stop eating cheese sticks every night. And so it's personalized, it's quality. And I can't tell you how many people are wowed at just that little bit right there. They're wowed, like, wow, man, no one's ever explained this to me. And I'm like, honey, I got a script in my head. I just run through these things all day, every day. So that's one of those things that's adding a unique value, and it's quality. And now that patient's getting a personalized approach. They're getting a care plan designed specifically for them, not a rubber stamped of everybody gets this, that, or the other. Okay. Secondly is imaging. If you're ordering mammograms, you're ordering ultrasounds, you're ordering whatever, bring them back into the office. It's already scheduled that they're coming back, because you don't want them to have it done and then you have your front desk call and say, please call Miss Johnson and get her scheduled to go over her CT. Miss Johnson just gave herself breast cancer when you call her back. That's just what she's decided. It was so cute when I first started. Patients go, do I have AIDS? I'm like, honey, I didn't even test for AIDS, and it's not AIDS, it's HIV. Like, so if you have a standard, it's already established that Miss Johnson, good, bad, or indifferent, you're going to sit in this chair and I'm going to tell you what your results are. It decreases anxiety. They come in, they're like, okay, all right, that's what it says. So that's providing quality. Having some standard protocols for things. You don't want people missing works for UTIs and yeast infections and bacteria vaginosis. That woman is 53 years old. She's had that vagina for 53 years. She knows what a yeast infection is. Do not make her make an appointment and come in to be treated for a yeast infection. Have some standing orders. Either you send it or your team sends it. Send that woman some diflucan for that yeast infection. That's quality, so that she's not online buying boric acid suppositories or whatever the latest tea tree oil is. And then if you offer a weight management program, which I'm most certain that you will, what's your protocol for that? Here at Ultimate Health, the very first visit for a weight management consult, you come in, my nurse gets all your vital signs. She'll teach you how to use the app. She'll give you some basic rundown. I go in, I do a consultation, I'll develop your plan. And then from then on, every week when you come in, you're seeing my medical assistant. And my medical assistant is weighing you, and she has some autonomy to make medication adjustments based on if you're eating, you're not eating, you're still hungry, you're having symptoms, you're having side effects. She has a set protocol of things that she can prescribe or distribute. So if we want to add Topamax or if we want to add some Miralax, she has that leeway, and that's providing quality. The quality is in that there's no delay. It's not, well, wait, let me go talk to Amanda, or wait, you need to get on the schedule for Amanda to come in. Come on, man. We're DPC. We're better. We're better than all that. We are putting the patient at the center of our care. And in putting the patient at the center of the care, we do what's convenient for them, which is not waste their time. When we're providing quality care, we are also providing preventative services and chronic disease management. So as a direct primary care provider, I order the mammograms, I do the pap smears in office myself, I send for the colonoscopies, I follow up on if you've had those things done. I will fuss if you have come back and I'm like, so did you get your mammogram? Well, I have the order. I'm like, and I would like the report, lovingly and kindly, but they know that I care. Because unfortunately, in my career, I have diagnosed 3 breast cancers. And one of those I remember very clearly. I was harping on her for 2 years. Get your mammogram, get your mammogram. And she finally got it, and it was breast cancer. So preventative care, chronic disease management, that's the diabetes management, that's hypertension management, high cholesterol. My diabetics, I love to brag, we don't have an A1C of 9, 11, 12, and 14 in this practice. You may walk your tail in the door with it, but I promise you, after a couple episodes, we won't do that. So I have a standard. If your A1C is greater than 7, I'll see you in 3 months, friend. And I encourage them. I love you. I want to break up with you. I want to see you in 6 months. So let's get that A1C under control so that we can have less visits with one another. And they do. That's quality. I lovingly say, get your act together. Also using evidence-based practice. Let's not be going with the latest trend. Let's use evidence-based. That the science says it works, let's go with that. Let's not use the latest snake oil. Fostering that patient-centered communication, that patient-centered care where the patient's driving the care. I have several who say, Amanda, I prefer not to take pharmaceuticals if we can. I say, no problem. For different disease processes, I know off the top of my head a couple of herbal or homeopathic regimens or remedies. But if I don't, and the patient has looked up something, researched something, has an article about some treatments, I am agreeable to send it to me or pull it up. I've got time. Let me read it here, and then we can say together, making an informed decision, does this work best for you? That person feels heard. That patient feels seen because I'm valuing what's important to them. If they do not desire to put metformin into their system, you don't have to put metformin into your system. We can talk about it. And no judgment. I love you all the same, metformin or not. That's quality care. And then optimizing your workflow. Let's get this thing going, flowing. Check-ins should be seamless. Getting your vitals should be seamless. Seeing you, I should not be sitting in the lobby for 25 minutes. I should not be in the room with you. So no double booking. Get your kinks worked out. Remember, before we opened, we did dry runs, and so we can adjust the schedule accordingly. I know in the beginning, my new patient appointment, I had it blocked for 60 minutes because in my old practice, that's what they gave me. And I had 15 minutes for a follow-up. I learned very quickly that I like to chat. Surprise. And so my new patient appointment block is for 90 minutes. And that's what I need. And I'm telling you what, I use all my 90. It's the patients, not me. They're chatting, not me. So you want to do some things. These are just some little things that would just provide that quality care. Implementing in your practice what they call them, KPIs, some key performance indicators where we say, hey, I want everyone seen within 3 minutes of arrival. We want them out of the clinic within X amount of time. We want initiatives to improve quality. If someone has said, I don't like that I have to do this, this, and this, taking that back to the huddle, taking it back to the group and saying, do we have to do it this way? Does it have to be done this way? One of the big things was with my weight management program. those who were really established and in maintenance, they said, Amanda, do I still have to come in here once a week for the injections? I've been doing this for 16 weeks. We took that back to the huddle and we designed a take-home maintenance program where after, graduation and your weight loss and you've been maintaining, you can take it home and administer it to yourself and you won't mess up the hard work. So those are things that we have done and that you can do to improve quality, because remember, this person may have health insurance and they're paying you above and beyond their health insurance. So it needs to be worth it. It needs to have a unique value proposition. You need to add value to their life. I cannot tell you, I believe 92% of my DPC population, they have health insurance. But they found the value in having me and their insurance. So the insurance pays for the test, insurance pays for the imaging, insurance pays for the prescriptions, but they pay to see me. And they don't feel gypped because I'm giving them all of this goodness. All right. Pitfalls. Remember, we talk about pitfalls, things to avoid. Let's avoid getting on a soapbox. Say you recently learned about the benefits of vitamin D. Let's not stress every person who walks in the door about vitamin D. I was seeing a provider for a service and he's got this exercise thing that he's really passionate about. And it was to the point that I didn't even want to go. I don't want to go there because I just do the thing I'm here for. I don't have time for you preaching. He's like a cyclist and he probably is a non-eaterin, not a vegan or a vegetarian. He just doesn't eat and just exercises. This big old country girl, she likes to eat and she's not a workoutaholic. So not getting on soapboxes, because I was to the point where I didn't even want to go receive the service anymore because I didn't want to hear all that. So let's not do that. Having a one-size-fits-all approach. Every single person doesn't need lisinopril. Every single diabetic doesn't need metformin, lisinopril, or atorvastatin. Let's not rubber stamp it. That's what traditional healthcare does. We don't do that. Personalized. So let's not get into the one-size-fits-all. And then the last one, big, it'll mess up your reputation faster than anything as a direct primary care provider. Not responding quickly enough. If you've given your patients access to you, respond in a timely manner. Do not say, oh, text me anytime. And then if the person texts you at night, you don't respond until the morning. Or if they text you during clinic and you don't respond until end of day, that's not giving what they paid for. I've got mine down to about 30 minutes. I mean, if it's longer than that, it's because I didn't see it. And my patients are very respectful because remember back when we talked about marketing, they see my life, they see that I'm newly married, they see that I have a family, and so they're very respectful of not being too intrusive in most weekend texts like today's when, Amanda, I'm so sorry to bother you on Saturday, but I was up all night with heartburn since getting on Ozempic. And I was like, I got you. And I said, okay, med sent. He goes, oh, I'm so sorry to bother you on Saturday. I said, honey, that's what you pay for. Hush that fuss. It's that. Responding quickly. If you go and you do your research on us and you look at our reviews, a couple of those reviews say they respond so quickly. That's how they talk about us. I like that. That's a part of my reputation. She responds so quickly. I can't believe it. But that can be a killer when you are in concierge medicine, direct primary care, when you don't respond quickly enough, when you don't sign that surgical release quickly enough, you don't get that referral over quickly enough, you don't respond to that mammogram was done, it's abnormal, you didn't call the person ahead of that scheduled time. So say it was scheduled for, you came in on July 1st, you got the mammogram on the 2nd, I got it back in my hands on the 3rd, but you're not scheduled until the 10th. And if I wait until the 10th, honey, you're going to be rolling your eyes and giving me a fit that I let you sit there for all those days with that abnormal mammogram. So these are some things that will add value, that will take you to the next level, that will have you at the top of Google and at the top of everyone's list for a top provider. I see lists all the time. I get tagged on Facebook. Someone will be new to town, looking for a primary that I can talk to, looking for a primary that, doesn't have an accent. Well, I do have an accent, honey. It's just from Winter Haven. Looking for a primary that has X, Y, and Z, and my patients will be tagging me in that. That's how I ended up there, because I provide quality care, my team and I. So I'll see you in our last and final module.